Hello, and welcome to FACTS webinar, Farmers First Aid, AEDs, and Bleeding Control. Our guest presenter is Erin, and I am Samantha Gasson, FACTS Humane Farming Program Director, and I will be moderating this session. Thank you so much for joining us. Before we dive right in, let me take a minute or two to do a few quick introductions. Food Animal Concerns Trust, or FACT, is a national nonprofit organization that works to ensure that all food-producing animals are raised in a humane and healthy manner. We accomplish this by supporting humane farmers through our humane farming program, promoting policies that make foods from animals safe and healthy to eat through our Safe and Healthy Foods program, and generally help consumers make informed food choices. Our Fund to Farmer grant applications are now open, and our mentorship applications for our mentorship program will be opening next week. Please visit our website at foodanimalconcerns.org to learn more about all of our farmer services. I'd also like to take a second to introduce my wonderful colleague, Catherine Hoke, who will be in the wings to help out in case of any technical issues, which actually I have nightmares about. So yeah, happy to have you here, Catherine. Thank you. At this point, I am very pleased to introduce our esteemed presenter, Erin Kersey. Erin is a firefighter and paramedic with the Medford Fire Department in Southern Oregon, together with his wife, Katie Mead, whose name you'll recognize from FACTS Humane Farming Program and our mentorship program. She runs our mentorship program, and she's just all around amazing. They own a diversified livestock operation. We are lucky to have Erin with us today to share his experience and expertise. So without further ado, I will turn the floor over to you, Erin. Please take it away. You're on mute.
Yes. Can you hear me all right?
Perfect. Perfect.
All right. I'm going to go ahead. Let me share my screen here. It's got perfect. Okay. All right. Real quick. Yeah, I'm a paramedic firefighter, and I work in Southern Oregon, as Samantha said. Today I'm just going to introduce a couple really basic concepts, and to the layperson, why we do what we do, and more specifically to farmers, why some of the actions that you can take early, as far as interventions go, can really make a huge difference and make a job for a paramedic or an EMT like myself a lot easier, and better outcomes for folks that we know and love. So these ideas aren't specific to just farmers, but we all know that living rurally can make it difficult. Sometimes response from EMS, first responders, ambulance can be 30 minutes to an hour. And if we look at some of these critical life-saving interventions, we don't really have a lot of time to mess around. We got to get to work. And my hope is that through this discussion, we can address some of these big things, and just as an education piece, kind of encourage everyone moving forward to seek out more. And on that, I just want to point out for my sign here, if you see, there's a fire extinguisher, an AED, and a bleeding control kit. All three of these things are very interrelated in my world. As you can understand, fire extinguisher, if someone's house is on fire, if it starts small and you can put it out with a fire extinguisher, then you will do half of my job for me. As we all know, similar to that are AEDs, and CPR trained persons in public that get the life-saving intervention started, so that when EMS arrives on scene, there is a more viable chance of saving that person's life. And a newer kind of, and I don't know how common this is all around the country, but a newer push along with these AEDs, and you'll see in the pictures, the bleeding control kit, and that idea of stop the bleed, Again, just like early interventions with cardiac arrest, can make a huge difference in improving outcomes for people. So moving on, I'll show this first question of what happens in successful cardiac arrest management. We talk about in EMS, the chain of survival, and the first it starts with early recognition and activation. And it's difficult for everybody to recognize the signs of cardiac arrest and to make the decision to one, call 911 and get help coming, and then to start CPR, and then going through the process of defibrillation with an AED is also can be very complicated. So hopefully we can touch on a couple things here that make that decision for all of you easier moving forward. This is not, I will say, a CPR course. I am a CPR instructor, but of course, all I can do is recommend that each of you get CPR certified. You can go to American Red Cross and look up your location and find online or in-class options. And if if there's one piece I can have in this discussion here today is to encourage everybody to get CPR certified, because it really does save lives. And so next, let's talk about cardiac arrest, early recognition and activation. First of all, there's a couple definitions that I want to make very clear. A heart attack is not the same thing as cardiac arrest. And while one can lead to the other, it is a distinction that I just wanted to make right here. If everybody already knows this, I'm sorry if I'm teaching you something that you already know. But we'll start with a heart attack. When someone is having a heart attack, what they're experiencing is heart tissue damage from lack of oxygenation to their heart. The heart is a muscle. It requires oxygen to operate, to work. And the feeling of a heart attack can be both slow or sudden, painful or not. I know a lot of times in television and movies, when someone's having a heart attack, they clutch their chest and they feel this chest pain. And that's not always the case. Sometimes it is, but it's actually not typical in women. Women more often will experience even some things as mild as like dizziness, nausea, and some mild like difficulty breathing, which I know I don't want to throw that out there to scare anybody, that if you experience those, that means you're having a heart attack. But there are some things that we just need to understand, that you're not always going to have that clutching your chest pain. But if you do have these symptoms, and the sooner you act, the faster you can call 911 and get help coming, the better the outcomes are going to be. So the pain in your chest can be temporarily relieved with either chewable aspirin or nitroglycerin. Nitroglycerin is something that needs to be prescribed by your doctor, and usually you'll have some either prior cardiac heart issues that will indicate that. And the two work together to help return blood flow to your heart, is the basic understanding of that. And a heart attack can be a precursor to cardiac arrest. It demands immediate medical attention, so please call 911. So what cardiac arrest is, as you see at the top, is your heart stopping, and which equals death. This can be a result of many things, and one being, a heart attack can lead to cardiac arrest. but also chokings, bleedings, allergic reactions, drug overdoses, all these things, in short, will make it so your body doesn't get enough oxygen to feed your brain, your heart, and will lead to death. Um, basic concept there is no blood to your or oxygenation to your brain, heart, and vital organs is bad. I put on here no pulse, and this is a tricky one, even for paramedics and lay people, or in EMTs, to feel a pulse. And if you don't feel a pulse, and it could mean that they still have a heartbeat, they might just have a very weak pulse. And we always want to err on the side of caution, and you'll learn in a CPR course that is when you activate the 911 system, you start chest compressions, and that will uh, get that ball rolling in the event that they are actually in cardiac arrest. Most likely the patient will be unconscious. The patient can have a gasping breath, even though their heart is stopped. Their brain is not really functioning anymore, but they will continue to breathe. It doesn't look like effective breathing. We call it guppy breathing, or gasping breath, that progresses to apnea, which is when somebody actually completely stops breathing. We talk about time is tissue, and the longer you go without oxygenating the brain, without oxygenating the heart, that tissue will die. And if you are to be successful in bringing that person back to life, their outcomes will be better in the long run. You'll have better neurological function and better cardiac function, better heart function moving forward, and be a healthier person. So this is kind of the concept I'm trying to put out there for everyone who's rural, out on a farm. If you start, even if you're not CPR certified, and you start pushing on someone's chest, hard and fast, we say, and you continue that blood flow, and you continue perfusing the brain, what's pretty cool is that the brain can survive for up to 45 minutes without any damage. And when you continue circulating that blood and oxygenating the brain, that you are going to lengthen that time. Okay. Now, the heart also needs oxygen to function. And you're also, as you're circulating that blood, you're circulating oxygenated blood back into the heart as well. And early recognition, early activation, early CPR, and immediate AEDs, that's what really saves lives. And I just want to speak, from personal experience on this. Now, as a paramedic, if I am, for example, dispatched to a call where there is we say a witnessed arrest. So the cardiac arrest, somebody saw it happen and immediately started CPR, and they have an AED on site and they're using it. I know this person, in my experience, is going to have the best outcomes. If there's no AED on site and nobody starts CPR, or it's unwitnessed, all those count against that person's chance of survival, because that chain of survival is gone at that point. And the likelihood from the moment I get dispatched to arriving on scene, I work in a city. And so usually I can be on site, on scene within 10 minutes, which is still viable. That's very much still savable. But the day before yesterday, I was dispatched, my crew, to a person that it turns out, had a heart attack. And he had a witnessed heart attack, and his friend watched him go down and started he called 911. He was coached through giving chest compressions. So when we arrived on scene, um, he was getting chest compressions, and he had what I would call those gasping breaths. He's in cardiac arrest, and we were able to put him on a monitor, essentially an AED, but the paramedic version of it, and we were able to shock him out of the arrhythmia he was in, and that his heart attack caused. And we were able to get his heart beating again, and we got him to the hospital where they got him into surgery. They gave him a bypass surgery, and he's thanks to his friend and the quick actions that he had. His friend is going to live on with no deficits, no neuro deficits, as we say, and good heart function. So that is what we call in my world, we call that a save. And I will give credit to our crew and our training that we were able to get to the patient quickly and perform all of our interventions, but a lot of that credit goes to his friend. And so that's what I'm basically preaching to all of you. Please be that friend, be that family member that makes that decision quickly. All right.
Aaron, could
Yes.
could you just could you go over what an AED, are you going to go over what an AED is a little bit more? I saw
Yes.
what I saw what it was on a couple of slides ago, but I just, if you wouldn't mind, it's automated external
An
defibrillator. If you could just go over that a little bit.
Yeah. Yeah. An
Thank
automated
you.
external defibrillator. So this is one of those things that we see in the movies a lot. Again, it's as a lot of people work in in medicine will laugh at movies, because whenever they pull out the paddles and they say clear and they shock somebody, that's because the patient's flatlined. They show this flatlined, and you hear the beep, and then they give them the shock, and then their heart starts beating again. That is not at all how that works. Um, in reality, what happens to the heart is, as it gets stressed, it goes into a bad electrical signal we call ventricular fibrillation, or VFib for short. And it does this really messy squiggle across the screen. And essentially, the electrical signals that are so organized that create this miracle that is all of our hearts happening right now gets fuzzy. And what we're doing is we're defibrillating that heart. We're applying oxygen to stop the heart and reset that signal. It's a bit of we call a control alt delete for the heart. And that's what the AED will instruct you to do. It instructs you to apply pads onto the patient, and it will read their electrical signals of the heart. If it detects that it's in VFib, it will advise you to shock, and it'll say shock advised, and it gives you all the instructions and walks you right through it. And it's pretty cool. Does that answer your question, Samantha?
Yes, it does. Somebody else asked, do you need a prescription for that?
For an AED?
Yeah.
No, it's advised because if you're going to use one, that you be CPR certified to follow the instructions, but anyone can use them. They make them pretty simple, and you just have to follow the instructions.
Oh, okay. Thank you.
All right. Now, let's move forward again. This is another education piece, and I'm not sure where. I know I saw everyone's, tuning in from all different parts of the world, and not everybody will have this. But if you look on your phone and you download the app for Pulse Point, it'll show you the regions that it covers. And what it does, it can show you um, where AEDs are located. And it's a quick mapping system. It'll show you where you are and the closest AED. You can also look at on that, you can look at different fire departments are signed up on that. And so you can see who's responding in your area to where you're located. I know where we're at, and and we're kind of on two county lines. And so depending on like which side of the county line you live on, you may not you don't know which fire department may be responding, which ambulance service may be responding, and a lot of this information can be found out through this app. If you don't have that app, I would encourage everybody to do a little bit of research into who is their responding agencies and what their capabilities are. Not all fire departments have paramedics. Some of them just have EMTs, and EMTs are very much able to do chest compressions and assist with breathing with a BVM, and they can do AEDs just like paramedics can. But there are some other higher level interventions that paramedics can do that can be beneficial, and you can find out that it will be helpful. So also what the kind of possible response time would be to where you are living. Uh, and if that does that answer that?
Yes.
Move on. All right. Um, Now like I said, the big movement to get AEDs in the public, you'll find them at airports, libraries, most public buildings, schools. They're everywhere now. At least that's the effort. The American Heart Association would like to see them everywhere. The other one that's becoming more and more popular is the Stop the Bleed movement, and this is a little bit kind of near and dear to farmers, partly because we work with heavy equipment, we work with sharp things, and I know if anyone here's like me, I will find myself oftentimes working on something where I'm not wearing gloves, and I don't even realize I've cut myself. Now, that's not the type of bleed we're talking about here. That's something that, you get a little nick on your finger. I'm sure all of you are very capable of basic first aid and getting Band-Aids. But what we're talking about here are more major bleeds, and big hemorrhages do happen, unfortunately, around heavy equipment. And there are some life-saving interventions um, that some training would be great. But without training, they are some pretty very, very simple interventions and tools to use that I think everybody should be capable of. And I'll say this before moving on. I understand some people don't like bleeding. Um, and I understand that it's near and dear to my heart. I know my daughter hates the sight of blood. And it's really scary for people. All I can say to that is when when you're in a position of aiding others, you'd be surprised how much you are capable of. When you trained on something, you've practiced with a piece of equipment that you're going to put on and save somebody's life. You'd be surprised what you can do and be capable of in the moment. Um, Now, if you look on the screen here, there's a YouTube video. There's a link to the company that makes this product, True Rescue. They're just one of many that you can find online. But they have a short video that walks through each one of these items and talks about how to use each one, and why they're used. But you understand the basic idea is that we need to talk about there are veins and arteries in the human body. Arteries are the vasculature that is coming away from the heart. So it is powered by that very powerful pump that is our heart. And so we know what an arterial bleed is oftentimes by the fact that it is pulsating, just like your heart is pulsating. Um, Whereas a venous bleed will sometimes be slow, but we do also have some very big veins in our body. And if we do sever one of those, we still need to control that bleed. Um, in the list here on the standard kit, you can order any of these online. The first one on there is a tourniquet. And I think a lot of you understand the concept of a tourniquet. We can make tourniquets with belts and other items if we don't have a tourniquet. But these, I'll show, we have these SAM tourniquets or CAT tourniquets at my work, and they are incredibly easy to use. They don't need to stay in the packaging. This doesn't need to be a sterile piece of equipment. You can take them out of the packaging and have them ready to go. But as you can see, it's a continuous loop. And on this end, what we call is, it's called a windlass. This is what we're going to twist in order to actually completely occlude, stop the vein. Just think about a hose. It's the same way as you're putting a kink in a hose, right? And if you are able to, just like in a kink in a hose, if you are able to both kink it, one, stop the flow, and just like on a hose, if you were able to stick your finger into the end of that hose and stop that bleed, you could very well save somebody's life. And the human body, the average adult has 4.5 to 5.5 liters of blood. And what we go into when we lose about 15 to 20% of our blood supply is called shock or hypovolemic shock, a low volume of blood. Once you don't have enough blood for your heart to circulate, it doesn't deliver oxygen very well to your brain and to your muscles, because that's what blood is carrying, correct? So we lose volume, we will go into shock, and after 40% of our blood loss, we will exsanguinate, which is to die from a loss of blood. Now, this is one of those tools that can save somebody's life. And I just want to address this really quickly because, as you can see on the sign on the side, tourniquets are for life-threatening bleeds only. You don't need to put this on the scratch on your finger. But the place we put them onto is onto our extremities only. So if you see in the green there, basically from the shoulder pit down and from the groin down, you need to be able to put this on so that it's at a 90-degree angle with the extremity. You want to put it about 2 inches above the bleed. And what I will advise you, if at all possible, is don't ever undo it. As you can see, this actually pulls completely out and becomes one long continuous strip. Don't pull that apart, because what you'll find is if you ever had to do this under stress, your hands are going to shake, and trying to feed that back through is very, very difficult. And if there's any blood, it's going to be slippery. And I know this is a little gory, but I just want to stress that if you can keep this intact, and just slide it over somebody's arm, for example. So if I have an arterial bleed here, I want to go lower on the arm, not ever on the joint. Or if I have it on the upper arm, I want to go 2 inches above it. And this just pulls as tight as you possibly can.
Hey, Aaron, I'm going to
Yes.
unshare your screen so we can see you a little bit better, if
Oh, I'm
that's
so sorry.
okay.
Yeah, that makes sense. I'm not good at this webinar stuff yet. Um, so
Thank
as
you.
I was describing, this is a continuous loop. And one of my partners here is going to show you. If this is Matt. Say hi, Matt.
Hello, good morning.
Uh,
I'm
so
at.
I'm going to slip this over Matt's arm, 2 inches above the affected area where I find the bleed. And I'm going to pull this as tight as I can. I'm going to feel for a pulse. And once I find that radial pulse right there, I'm going to twist this until I can't feel a pulse anymore. And then this locks in and I can secure it. And I'll just leave that on. There's no reason to remove it. You can leave them up to 2 hours on a patient and they won't cause any damage. Thank you, Matt. And this, as I said, is going to be, I'll share my screen again. The only on the extremities, and let me share. So that's legs and arms. If somebody has a bleed that is somewhere on their torso, that is going to be better stopped with what we say direct pressure and wound packing. And are you guys seeing that?
I think you shared the wrong window.
I did. Okay. I'm so sorry.
No, I totally messed you up because you were all set and I made you unshare so we could see it. So
No,
you
I
could
forgot that
see
you guys
better. Sorry.
couldn't see me the whole time. Yeah.
Well,
There
we
we
could see
go.
you. You were just a little thumbnail.
Just a little thumbnail. Ah, got it. Okay. Let's try this again. How's that?
Perfect.
Okay. All right. So wound packing is another skill that is not terribly tricky, but I understand does require a great amount of training to be good at it. But essentially, I just want to describe what you're doing is you are taking gauze, or what this is called hemostatic gauze, which has some chemicals on it that are good for stopping bleeding. And you're pushing them down into the bleed while you hold direct pressure onto that bleed. That's buttocks, pelvic regions, high in the shoulders. Those are the spots into that muscle that you need to pack the wound and hold direct pressure. And then anything that's between the collarbone and the belly button that can affect your diaphragm and your lungs and your breathing, that needs to be a chest seal. And all these items will, like I said, they do come on the in those kits, the Stop the Bleed kits. And a chest seal is just a giant sticker that goes over a hole if you do have a penetrating wound anywhere on your torso. And I don't want to go into too much detail on that. I know that sounds like a lot for a layperson to get into. It's not something that you're going to be good at right away, but I would encourage all of you to look into purchasing these if you do have a farm, and more YouTube videos, more follow-up, and that way, watching people go through it, like in the video that I have attached here, they will describe and show in some detail. If you've got the stomach for it, there are more hands-on ones that show on YouTube, actual bleeding and how to control it. And I understand, like I said, not everybody is very comfortable around bleeding, but just like early CPR, early, that chain of survival, this can be very much a life-saving intervention for somebody. And I think beyond that, calling 911, and the last thing is to keep the person warm. When people go into shock, their bodies aren't able to regulate their temperature anymore, and this creates a deadly cascade of chemicals in your body that even if you do stop the bleed, can still be fatal. Can That can be prevented by keeping the patient warm, grabbing blankets, getting them indoors, and just basic, common sense things like that. And while you wait for an ambulance. And I think that's all I got. I'm not sure how we're doing on time. I hope I didn't go over, but does anyone
And
have any questions?
right. Okay. So this is great. I've actually got a poll that I'm going to go ahead and launch if you guys wouldn't mind answering that poll. And thank you, Aaron, very, very much. That was really good. I don't know. This has like been one of my things this year that I want to become better equipped if something happens on the farm.
Yeah.
And yeah, it's I've been watching YouTube videos and everything. So I was really
Yeah.
glad when I
Good.
confessed
Good.
that to your wife. She suggested that we do a webinar with you, which I think is brilliant. And I'm so glad
Yeah.
we got to do it. Okay, so I'm just going to give a few more seconds, but what with the poll, but we will go ahead and start asking questions. We've got some
Okay.
really interesting questions in the chat. Um,
I
do
do
you want to
too.
take,
So
do you need to take a water break or are you ready to go?
no, I'm fine. I can start
Okay.
going through these.
So Victoria asks, is
Yeah.
it true that cayenne pepper can also help when someone's having a heart attack? 1 teaspoon taken by mouth.
Um, I honestly I can't speak to that. Other than I would think if you're doing it in lieu of giving aspirin, I would give the aspirin instead. Cayenne pepper isn't going to do the same things that aspirin does, which are um, they basically help keep the blood from clotting too much, which the clot in your artery in your heart is what's causing the heart attack. So I would just try to get aspirin, and like I said, and chewable aspirin if possible. They come in these little 81 milligram. They're over the counter. You give them 4 of them, and don't make your friend or loved one chew on the aspirin that you normally swallow, because that's just cruel. But anyway, yeah, no, it'll still work, but it's just the chewable dissolvable ones are much nicer.
Okay. So if you have bottled oxygen available, should you try to use it? And if so, how?
It's a good question. I think it's an odd thing how oxygen can be difficult to obtain for everybody, and as most importantly is the regulator that delivers the oxygen from the oxygen bottle. If you buy, there are 3 things. There's the most simple is a nasal cannula that goes into the nose. This will provide what we call passive oxygenation, as well as the non-rebreather, which is just the mask, the simple mask that goes over their mouth. That you can deliver a little higher flow, a greater volume of oxygen. But the type of oxygen delivery that we want to give is we give positive pressure ventilations through a bag valve mask. And you can also purchase those. They connect right to your oxygen tank. And what I will advise is that is not an easy skill to perform. And um, most often, I would say what you could do is you could actually end up hurting somebody by giving too many breaths too fast. And what ends up happening is you pump a bunch of air into their stomach, which causes them to vomit, which is obviously not good. So I'm not advising everyone go out there and just buy bag valve masks. Let me make that clear. But that is just the way that the professionals will deliver that oxygen. I hope that answers your question.
All right. So if you're way out of town, what should you keep on hand, even if it requires a prescription?
That's a tricky one. I always say, there's no bad questions, but a good question has more than one answer. So prescription medications, I would only advise you to, in this case, the things that your doctor has prescribed you and you've discussed with them. I'm not a big advocate for using medications that are not designed for human use, as for example, using things like from your farm store, like insulin or antibiotics on humans. I don't subscribe to that. But I don't want to talk on that too much, but I would only just say that is that there are certain things that you can purchase. Epinephrine is a big one, and it's the classic EpiPen for folks who have allergies. Bee stings, and all those types of things that epinephrine, epi can fix. I do encourage people to keep those around. I keep one at home, even though nobody in my family has any allergic reactions. It would need it, but it can be very much life-saving. And not to get onto that too much, but I will say this really quickly. If someone is having breathing problems and they're going into anaphylaxis from an allergic reaction, Benadryl will not save their lives. Benadryl is for hives. If somebody has hives in an allergic reaction, the Benadryl will fix the hives. The Benadryl will not fix their breathing. Okay.
All right. So I guess you would also suggest maybe I'm writing this down because I'm going to get some of this stuff. So I've got to stop the bleed kit that my
Awesome.
my cooperative extension gave it out, which was really nice. So I got it for free. So I've got one of those. So I feel pretty good about that. I'm going to get some aspirin. Now it sounds like I need to get some epinephrine. And then somebody asked in the chat, how much should you expect the AED to run?
AEDs, yes, they are anywhere from $100 to $500 depending on their capabilities. And I can't speak to that from experience because my department pays for them and buys it for us. But we don't keep an AED at home, but I do know, for example, based off of the PulsePoint app, I know where the closest AED to my house is, and it's less than 5 minutes away. So I would encourage you, if you don't want to purchase one for yourself, to look into where the closest one is.
And so that sort of feeds into the next question that Jim had. And what resources, grants are available to help fund the purchase of an AED or stop the bleed kits? And I think I know because I know Jim, and he's in Oregon as well. And he does, or maybe you're in Washington, Jim, I forget. Anyway, no, you're Oregon. But he does also a lot of on-farm events, so dinners and things like that. And so it might be worth it to have something like that and get trained if you're used to if you have a lot of people coming out to your farm. And I've thought about that with summer camps as well. When I do my summer camps, that it would be nice that I did at one point get CPR certified, but I haven't done it recently. So it just as a follow-up question, how often should you get recertified for CPR if you're under those kinds of conditions, just where you're doing it just sort of as a safeguard if you've got people visiting the farm?
Recert is, I believe, still 2 years. So every 2 years you need to get recertified, and it's about anywhere from a 6-hour to 8-hour class, depending on where you are regionally and what your instructors are teaching. So a lot of it, the portion of it has to be hands-on. So you got to get your hands on those mannequins and do you count your respirations, do your 30 to 2s, and sing "Staying Alive" in your head.
So do you know of any resources or grants available? Like I said, I was able to get mine from
don't.
my cooperative extension, the Stop the Bleed, because I think that's a national program, but
That's awesome.
I've never heard anything about AEDs.
I don't know of any either, and I couldn't speak to that. Sorry.
All right. Somebody has a question about any snake bite protocols, and Catherine actually said that there's a great Facebook group called the National Snake Bite Support that she
Okay.
recommends you checking out. But she lives in this person lives in an area with rattlesnakes and copperheads.
Yeah.
Pretty much all of us do. It seems like they're very. We have them here in
Yes.
North Carolina too. So, what would your protocol be for snake bites?
Um, that is, I mean, other than the basic first aid things of cleaning, keeping the washing it with soap and water, um, we will create not a tourniquet. We don't want to tourniquet that appendage, right? We don't want to. That's not necessarily going to stop the blood flow back to your heart, but what we will do is we will um, try to splint the appendage. Like if it's in your leg, we will splint your leg so that you can't move it, because the way your veins work in returning blood back to your heart is through movement, and a complicated set of valves in there. But if you are able to keep the appendage from, keep it still and not move it, uh, as well as it's easier said than done. Try to keep yourself calm. The less adrenaline we have that's driving our heart and pushing that blood through our system, is the slower that venom can get to our hearts, which is what we're trying to avoid, or at least slow that down as much as possible. And then what we are going to do is then we're going to, drive fast and start IVs and treat for pain. But that's pretty much it, other than what you see on a basic Google of like keeping it clean, trying to keep it below your heart. And that's all I can say to that. Yep.
That's a lot. Thank you.
Yep.
And Mari actually has a very good question. Is there a shelf life on those Stop the Bleed kits or the AEDs?
The AEDs, no. Eventually you will have to replace the pads on the Stop the Bleed kits. We have a policy within our department after COVID, because we had supply chain issues. A lot of the items will have expiration dates on them, but we, um, for lack of a better way to describe it, we pretty much just ignore the expiration dates on a lot of those items. Obviously, anything that goes internal medications into your body, we are very strict with those expiration dates. But anything that's plastic and in a package that's not exposed to sun and not exposed to air, oxygen, it will last a very long time. Yeah.
Well, I will say that my husband had a bleed on his leg that wouldn't stop bleeding, and I
Wow.
used some vet wrap on it because, of
Nice.
course, I used vet wrap on it. But it was like that vet wrap was way back and dusty and gross, but it was in the package still. And I went ahead
Okay.
and used that. It's probably 20 years old, and it still worked. So,
Well, and this is another little thing I'll throw in there. If somebody we have these measures that are called stopgap measures. We're talking about kinking the hose. There's a very big hose, so to speak, as an artery that goes through the center of your abdomen, and your abdominal aorta is what we call, and that feeds down into all your lower half of your body, and that you can put your knee into someone's stomach, like right above their belly button, if they have a pretty serious bleed below the waist, and you will stop that bleed by just putting your knee into someone's stomach. And it's pretty incredible. I've had it done to myself just in training, and you can still breathe and you're still fine. It requires a very little amount of pressure to stop that bleeding.
oh, very cool. Somebody said excellent presentation. I agree. I think it's excellent
Thank
as
you.
well. Levon says, how would you treat for a bee sting in individual or a swarm for those with allergies?
The swarm. Yeah. If you have
Yeah.
an allergy, I just want to first speak to that. Anytime your body is introduced to an allergen, the first time your body is introduced to it, you will know if you have an allergic reaction to it or not. Oftentimes, even from just this most simple thing is like you eat a strawberry and the back of your throat tickles. Um, your body will let you know. It's a pretty good communicator to you, to you of it didn't like that. So um, what I will say is that the chances of you going to what is called anaphylaxis, which is a type of shock, which closes off your airway. This is your body's way of protecting itself from some sort of pathogen, something that's invading your body, overreacts and says, well, guess what? I know how to keep this out of my airway. I'll just close off my throat. Not great, right? Um, and there's a lot of other cascades of weird chemicals in your body, mostly catecholamines, as we call them, and they're not great. One of those, though, epinephrine or adrenaline, if it's what it's going to do is it's going to save your life. And you have that naturally in your body. It's what makes your heart beat faster and stronger when you need it, when to run away from the bear. And I will say that if you do go into anaphylaxis, the one and only cure is epinephrine. And um, in most doctors will tell you they give epi, and then more epi. And so sometimes the automated injector will have 2 doses, uh, and the auto injector you should be able to give 2 often. And so what we'll do is we'll start IVs and we'll give even more doses of epinephrine through your IV. And I hope that that never happens to anybody. That's a miserable, miserable feeling.
Yeah, that's pretty scary. I love this next question on so many
Yeah.
different levels. My son packs into the high country sometimes with old guys, and I don't know what this person means by old guys. So is this like guys in their 90s? Is this guys in their
Yeah.
70s? What do you think of when you think of old guys? Um, and
Mm.
she or he would like to know what are the most important things he should take, I guess, for the old guys. I love this question.
Yeah. Okay. Well, beyond the obvious things of staying hydrated and bringing enough stuff to keep yourself warm, uh, the bleeding control kit is essential. We have a lot of guys, and my coworkers that go out hiking and hunting for long trips, and they all bring stop the bleed kits with them, and that's for young and old. um, Now, I think it is a very real thing, though, that anybody in that old category that gets up hiking at high elevation, especially where you could have uh, difficulty breathing from high altitude sickness, all those types of things. Um, the I have personally treated people who have come back from hunting trips, and they're like, oh yeah, and this chest pain started like 2 days ago, and they've basically been having like a massive heart attack for 2 days, which can happen, and then slowly progressed. And again, going back to that time is tissue, just having an understanding of that and being able to recognize it and saying, hey, if you have that chest pain or those signs and symptoms, maybe it's time to head home.
Mhm, mhm.
Yeah.
All right. Emma asks, how do you determine when a cut needs stitches?
Um, Mostly, it's either going to get sutures or staples at the hospital. We don't perform those. What I always encourage people to understand is, yes, I've done the super glue, don't use super glue. They do make specific super glues, like first aid super glues for cuts, that burns a lot less, speaking from experience. Um, and, and if it seems like something that's not going to heal very well, and that brings in two problems. If it's not going to heal fast and it has chance for infection, you have a higher likelihood of going on antibiotics. If you bring it in, and you're able to get it cleaned up properly and stitched, we usually say if it's a full thickness, so it goes through the dermal, epidermal and dermal layer into the muscle, or is greater than about an inch thick, we'll encourage people to go in and get sutures or staples.
Okay.
Yeah.
And could a belt work in an emergency as a tourniquet? That's what you always sort of think of as a
Yeah,
tourniquet. See, like
it
from the
does,
movies.
and if I share my picture here again, I'll show you if you can still see it, right? The hemorrhaging bleeding where it shows the belt. Do you see that?
I actually am sharing my screen now. If you want to share
Oh,
your
okay.
screen.
If you can, okay, should I share mine now?
Yeah.
Yeah, that it's not the belt can, but I will say whatever you're holding that belt on with is going to be not as effective as if you can use, you can create your own windlass. So you can get that belt on, but then the stick that you put through that, have hopefully something that's strong that's not going to break, is going to actually create the greater amount of tension through that twisting motion that's going to actually be the most helpful.
Okay, and we have one last question, and then we'll do a little bit of housekeeping.
Okay.
What about degrees of burns from chemicals?
That's a tough one. We say, first of all, burns, you've heard probably first and second and third degree burns. We call those now superficial, partial thickness, and full thickness burns. Superficial is pretty much anything that's, think of like a sunburn, something that makes your skin turn red and it hurts really, really bad. Those types of burns, you want to flush with water. You want to get away from whatever chemical that you're obviously exposing yourself. But there's so much minutia to that because, for example, a perfect example everyone should know in farming world is that lye is not something that you want to put water in. So it's a tough question to answer as far as treatment goes. And I would just have to say I encourage further education on that. The second and third degree burns, if it's into the dermal layer, which is just below your most superficial epidermal layer, and into your beyond that into your muscle and fat. Those are very dangerous burns. We don't want to use wet dressings on those. We want to keep those dry. We want to keep them as clean and as sterile as possible. It's really hard to keep those sterile, but and keep them warm. And because as that tissue it dies, your body loses the ability to maintain your body heat in that area, and you can become hypothermal, and can also be deadly for you. So I hope that answers that question. Chemicals are tough. I would love to be able, that's a whole nother class. So it's a very good question.
Yeah.
Yeah.
Well, somebody asks about lye burns. Can vinegar stop a lye burn?
Yeah, the idea is, yeah, with a base, you neutralize it with an acid. Yeah.
All right. Well, Aaron has just come off a 48-hour shift, and he is exhausted. So we're not going to take up any more of his time. I have a few housekeeping items to share before we sign off today. A recording of this webinar on the slides will be available within the next few days, probably tomorrow. These documents will be archived on our website, and I will email them all to you tomorrow. We also have some other good webinars coming up this autumn, and I will send links to all of our upcoming webinars and other opportunities for farmers and ranchers in the following email. well. A sincere thank you to Aaron. I can't believe you've just come off of a 48-hour shift and you're still willing to do it. I would have said, no, I'm going to bed. It has been a pleasure. And finally, I would love to share, send a huge thank you to everybody out there in the audience. You guys have great questions, as always. You're amazing. Enjoy the rest of your day. Goodbye for now, everybody.
Thank you, everybody.